This is our online review for Preventive Medicine and Community Health seminar. Our seminar exam would have 200 questions, 15 of which would be coming from PMCH 1, 2, and 3. So first, we tackle levels of prevention. You have to know the difference of primary, secondary, and tertiary. Primary is for prevention, examples of which would be vaccinations, health education. Secondary would stand for screening, examples of which would be blood pressure monitoring, annual physical examinations, school examinations, and pap smear. Tertiary would be treatment and control of disease progression. So anything that would need treatment and rehabilitation would fall under tertiary. Then we discuss natural history of disease. So in disease, we have three outcomes. You either die from it, you have disability, or you recover. So we have stages of susceptibility. That is wherein you carry risk factors for the disease but do not have any trace of illness yet. Stage of subclinical disease, this would be your asymptomatic stage. You have your pathogens inside your body, but it is not enough to cause any symptoms. Then you have your stage of clinical disease. This is where your symptoms set in, and disability, wherein you have the repercussions of disease when you cannot completely recover or when you do not die from it. So we have our family. Know the difference between nuclear, extended, blended, mixed, single parent, and communal. Nuclear is the typical family that we know of, with only our mother, father, brothers, and sisters. Blended and mixed would have your extended family, either your grandmother or aunts and uncles and cousins. Mixed would be divorced parents living with one another. Single parent with just one parent. And communal, wherein you live in the community. So we already studied family tools, the APGAR, wherein we study questions that would see the family's adaptability and partnership, growth, affection, and resolve. How it is scored, it would depend on it being severely, moderately dysfunctional, or highly functional. So we have our family life cycle as well. So it starts from an attached young adult, newly married, married with young children, married with adolescents, and empty nest or family in later years. So each one would have issues that they have to overcome in different stages of life. So there are other family tools. The lifeline is like a chronological history of specific milestones in the family. Your family map and genogram would be your relational tools, wherein you put conflict or if they are enabling each other, and you see things at an instant. Your stream assesses the capacity of the family to participate in healthcare. So this is your social, cultural, religious, educational, economical, and medical aspects, and how they could respond to disease when giving the following. And your draft and family circle would be primarily for your pediatric patients, wherein the child draws a family and puts the name in the circle or outside the circle to see closeness or nearness to a person. And then you have to know how to create a wellness plan for the family of an index patient. So you have to know what are the vaccinations to be given to a particular age group and what are the screening tests for a particular age group. In biostatistics, we tackle types of data. So there are two datas. There could be primary versus secondary. Primary of which you witness that you gather the data yourself, such as in surveys, interviews, focus group discussions, etc. Secondary is when you get data from other sources gathered by someone else, such as journals, books, etc. So remember, there would be continuous and discrete data. That is your continuous being with decimal points or fractions. Discrete would only have whole numbers. Then know the difference between qualitative and quantitative data. Qualitative could either be nominal or ordinal, which shows ranking, or non-ranked data, but it shows difference. And quantitative data would be of numerical value. Mean, median, and mode. You have to know the difference. Mean is a simple average. Median is the most middle value if you arrange it from lowest to highest. And mode is the number most often occurring in your system. Know the meaning of the following. Know what is validity and what is reliability, what is accurate and what is precise. So remember your bullseye example. So you can be precise without being accurate, but you cannot be accurate without being precise. So that is called a systematic error, wherein your falsely calibrated measuring tool would give you a consistently off-target measurement. Then you have to know types of sampling, types of which are simple random sampling, systematic sampling, stratified sampling, multi-stage sampling, and quota sampling. Non-purposive sampling would include simple random sampling. This is your fishbowl method. Systematic sampling, wherein you get samples from every 10th or every 15th item. Stratified and multi-stage sampling, it's wherein you do stages of clustering, then you further stratify or further classify it into other subgroups. And quota sampling, wherein you get data up to a certain number of examples. So purposive sampling would be looking for expert opinion. Snowball sampling, you will get for referrals, especially when your topic is very sensitive to discuss. Then we go to epidemiology. What's important to learn in epidemiology is knowing case definitions. So these would be standard criteria whether a person has a particular disease. And knowing population, this would be the set of all measurements that would be of interest to the researcher. You have to know parts of a research proposal and its function. So you have to familiarize with yourselves with your title, how to make objectives and hypotheses, how to make a proper review of related literature, methodology, and bibliography. Familiarize yourselves with study designs. So there would be the following: descriptive or analytical, case control, case reports, case series, cohort, and randomized controlled trials. Randomized controlled trials of which are the ones that avoid bias, are, are delineated with well populations, and eliminate confounding. So we have our sample size. Rest assured, I will not ask you to compute. So for publications, you have to remember peer review. This is the process in which an author submits a written manuscript or article to a journal for publication. Submitting it in more than one journal would mean it's a duplicate publication. Submitting someone else's work would be plagiarism. Then you have to know exposure versus outcome, and should know how your confounding variables would affect exposure and outcome. A well-represented population would affect exposure and outcome, and how to eliminate bias as not to affect outcome. And then we saw before our own eyes an outbreak unfolding. So you would have to know why it is important to know and determine what is an outbreak, and the importance of research and epidemiology in outbreak investigation, and how important contact tracing would be. Animal research ethics, you also see it in unfolding. Testing of your vaccines would naturally be tested on animals before it would get human trials. So you have to study how animal research ethics would come into play in medicine. So for your third year, we studied public health, and we saw health equities shatter. Empowerment of individuals to challenge and change the concurring unfair and steeply graded distribution of social resources to which everyone should have equal claims and rights. Your healthcare system is the sum of all organizations, resources, institutions whose primary goal is to improve health. And health economics, wherein all costs are considered, returns, and health benefits. Then we should prepare with disaster. So we see how ill-equipped our country was in managing a natural disaster such as the Taal volcano, as well as a pandemic in the coronavirus. Then we see the role of community organizing unfold before our eyes. So we have to raise the awareness of certain individuals so that we could organize and mobilize them to act on interventions. For example, the lockdown, you really have to inculcate on the people how important self-quarantine would be and its role in killing the virus. Out of 100, it's lucky that you would convince 30 to 40 people, and around 1 to 2 people would be aware enough or get aroused enough that they would also go out and convince others to go and stay inside the room. So know your vectors, although I would leave this mainly to microbiology and medicine. So know your agents, environment, host, and policies, and of how to control the diseases. So we also tackled maternal and child health as well as HIV and substance abuse. So know the impacts and implications of certain diseases such as the cholera. Of course, we studied the geriatrics population, now very vulnerable to the coronavirus disease. Um, That's why they are a marginalized sector and that we have to take care and give our attention to them. So our health situation, so there's devolution. This is the local code of 1991, which transferred the power of giving health to the people to the local government. It's good if your local government is performing, but it would be detrimental to the health of the people if your local government is at a loss as well. So there are various health systems as mentioned in the previous slide, and we have to maintain our sanitation, especially with the emergence of and re-emergence of certain diseases, and know common diseases and their epidemiology and prevalence, such as tuberculosis and pneumonia.